Okay, so welcome everybody. Thank you very much for joining. This is a webinar on monitoring hand hygiene in public places. It's convened by the WHO UNICEF Joint Monitoring Programme under the umbrella of the Hand Hygiene for All Global Initiative. We are going to be talking for about the next 2 hours about a recent review of data collection tools on monitoring hand hygiene in public places. And we're going to hear some country level experiences with case studies from Nigeria, from Kenya, and from Indonesia. We have quite a packed agenda, so I think we will get started. If you haven't done so already, please do introduce yourselves in the chat box. And I would also like to encourage you, if you have questions or comments during the presentations, to type them into the chat box, and the moderators will try and respond to them or encourage the presenters to respond to them as we go along. But in order to get us started, I'd like to firstly pass over to Bruce Gordon. Many of you will know Bruce. He's the coordinator of the Water Sanitation, Hygiene and Health Unit at WHO. Bruce, over to you.
Okay, well, thank you so much, Tom, for just getting us started here, and thanks everyone that have joined. And certainly on behalf of UNICEF and WHO, welcome to this webinar. I think it's going to be a good practical webinar that's focused on a real need. And just to kind of frame things a little bit, I wanted to just bring us back to the very beginning of this pandemic, when we were all thinking about hand hygiene as really in a way, the principal immediate prevention kind of tool. And of course, now as we have vaccines and we know about physical distancing and masks, these have also come on board. But I remember right at the beginning, there was this advice that we needed to, wash our hands, and we could do something. And there was obviously a lot of concern from the JMP's data in terms of its lack of hand hygiene in homes, schools, and healthcare facilities. But there was a real, even a more kind of dearth of data in these public spaces. And WHO at the outset was in discussions with UNICEF and IFRC, and we made a recommendation for obligatory hand hygiene in public spaces. So things like markets, transport hubs, commercial buildings. And the idea was to prevent COVID. But of course, as we sort of have moved on in the evolution of this pandemic, we see it as all the more important for prevention of everyday common colds, flus, pneumonias, general reduction of burden of disease. So this is incredibly important. And that's why we have the Hand Hygiene for All initiative, which this is a working group kind of initiative of, and you'll hear more from Nat. But the question was really, when we make a recommendation like this to all member states, what happens afterwards, and to what extent are these recommendations adhered to, and what tools, what initiatives, and how much progress are member states making on this? So I have to say, Tom, I think you will agree, and all the colleagues, that there was a little bit of chaos, where there was a lot of anecdotal evidence. I think there was a lot of rich kind of sharing of various kind of information on what was happening in these sort of public places, but there wasn't kind of a firm idea. I think maybe that still holds true. And as far as good practices and what is the best way to actually monitor for these things, I think that, again, it's a little bit like we need a lot of consolidation and sharing. So that's really the purpose of this. But just let me say that, just in closing, that I think as JMP kind of keeps looking at the evidence on this and possibly comes up with core guidance questions for countries, it's absolutely, I think, essential that we get some international sort of comparability and standardization to this method, because this is just an incredible way to prevent disease and illness and infection. COVID or no COVID. So, you know, I'm so happy that everyone is here to kind of explore with us how to do this. So back to you, Tom.
Thanks, Bruce. So huge interest, I think, in this topic, particularly in response to the pandemic, but lots of questions about how we go about measuring and monitoring at a national level, firstly, and then, of course, how we can go about aggregating national data in order to be able to produce any kind of regional or global estimates. I'd like to turn briefly now to Nat Painter, who is coordinator of the Hand Hygiene for All initiative, just to give a few opening remarks from his side. Nat, over to you.
Great, thank you, Tom, and good day to everyone who's joining us from around the world. Bruce, it's hard to follow Bruce because he really summarized the key points quite well, but really wanted to take a minute to talk about the Global Hand Hygiene for All initiative. And as Bruce said, it really came out in response of the global pandemic around COVID-19. But what we've seen in that time is this unprecedented attention towards hand hygiene. But we also know that that attention is fleeting. And so the larger objective of the Hand Hygiene for All initiative is how do we take this, the attention, the resources, and really the political will, and move it into more sustainable programs. We want to make sure that hand hygiene is integrated within national policies and programs, because it's really always a good idea to wash your hands. You don't need a pandemic to justify it. As Bruce mentioned, it is one of the the most cost-effective and effective ways of addressing a whole range of respiratory and diarrheal diseases, and no one ever regrets having washed their hands or have made investment in a hand hygiene program. The hand hygiene of public spaces is a critical part to that. Being able to understand how communities are performing and ensuring that people are washing their hands and have access to hand hygiene facilities with soap, water, alcohol-based hand rubs at marketplaces, transit hubs, community centers, areas like that. That's going to be critical as we go forward to succeed, one, in moving past the COVID-19 crisis, getting back to schools, getting back to normal, but also as we look towards the next global crisis, which there is probably something on the horizon. It may not be COVID-19, it may be something else, but we know that hand hygiene will be a critical role in mitigating the impacts of it. So thank you all for joining. Really excited to see this discussion and to hear about the progress on monitoring hand hygiene in public spaces. So Tom, I'll turn it back to you.
Thank you, Nat. Very nice to hear all of this interest in hand hygiene coming together under the umbrella of Hand Hygiene for All. This is how we're going to use our time. So we're going to start with a presentation which is going to summarize a review that has been undertaken of the various existing tools that are available for monitoring hand hygiene in public places. And then we're going to hear case study examples, firstly from Nigeria, where we have the example of the National Wash Norm Survey, which has been conducted in collaboration between the Ministry of Water Resources, the National Bureau of Statistics, and UNICEF in Nigeria. We're going to hear from Indonesia about the 3M initiative, which is about remote monitoring of hand hygiene in public spaces using volunteers. And we're going to hear from UNICEF, Indonesia, and the Ministry of Health. And then thirdly, we're going to hear from Kenya, the experience of monitoring hand hygiene in public places, which is an initiative in collaboration between the London School of Hygiene and Tropical Medicine, AMREF, and MBCC. And then at the end, we're going to open up for questions and discussion amongst the presenters, but also from all of the participants. So I'd really like you to type your questions and comments into the chat box as we go along, so that we can continuously raise those points to our presenters and have them respond to them. And there will also be opportunities at the end for people to unmute and contribute if they would like to do so. But in order to keep to time, I'd now like to introduce Peter van Manen. Peter is very well known to many of you. He's a very experienced consultant working in the WASH sector, and he's been working very intensively on this review of existing data collection tools. So Peter, over to you, and I think you have about 30 minutes for your presentation. Thanks.
Thank you, Tom. Yes, in these 30 minutes, I'm going to discuss the main findings of the review of monitoring tools that are designed to track hand hygiene in public spaces. I will not be able to discuss all the details, of course, so for more information, please, I will refer to the report. I will skip this slide because we've already heard about the Hand Hygiene for All initiative and the origin. So let me go straight to the next slide here. This is just to say that before this review that we will discuss now was undertaken, there was actually a different kind of mapping and gap analysis done more broadly on monitoring tools for hand hygiene in different settings. So a catalog was created in which more than 100 monitoring resources can be found. That catalog is available. And it is basically an Excel file with a Dropbox folder. And there we find monitoring resources on all settings, household, schools, healthcare facilities, and different kinds of resources, targets, standards, indicators, data collection tools. And the conclusion of that exercise was that there were few tools that were specifically designed for the COVID-19 response, and most were routine monitoring and mainly for institutions such as schools or healthcare facilities and at household level. Very few monitoring resources could be found on public spaces, work environments, and detention centers. And the working group, the monitoring working group under the Hand Hygiene for All initiative, decided to focus on public spaces to dig a little bit deeper. And that is the review that we are now going to discuss, of which the purpose is just to see what is available, how is hand hygiene monitored in public spaces today in different countries, and to what extent can we say that there are gaps. So let's have a look at that. Here, this is a screenshot of the catalog with the Dropbox link. I think maybe this link is available in the report itself, and I think Rick, he will share, or we will show a link to that report in this presentation. Let's quickly look at the review methodology. So what counts as a public space for this assessment? Well, based on the recent documents by WHO, UNICEF, and the Office of the High Commissioner for Human Rights, tools that look at the following spaces could be part of the review. So, for example, in front of public or private buildings and transport hubs such as trains or bus stations, markets, shops, places of worship, in front of schools, in front of healthcare facilities, and also, of course, in front of public toilets. And then the OHCHR document also makes reference to parks and streets, for example, more broadly for WASH, and of course, markets and transport hubs. So any tool that looks at these spaces could be included in this review. So the assessment framework consists of 3 parts. Based on the content of recent reviews of measurement instruments in the domain of hand hygiene, a review framework has been selected, and you can find more information on on how those reviews have shaped this this review. But basically, first we will conduct a mapping of the monitoring methodology of the tools. So we look at the data collection method, measurement technique, and so on and so forth. Then we'll look at the actual content of the tools. So what are they looking at when they are used to monitor? So we map them on a results chain, and we also compare them to determinants of hand hygiene. Finally, this review tries to assess the quality of individual measurements. So in the different monitoring tools, we will find questions, spot checks, observations. Now, can we say something about the quality of those measurements? And we've tried to do that using a few review criteria, such as the reliability and validity of these measurements, look a little bit at the potential for bias, and also to some extent to the response options. And finally, there's a little bit of also a presentation of the available data and the indicators that are used in the different tools. Well, when speaking with partners about monitoring in public spaces, it's clear that it's very challenging. And I think that the speakers that will follow me, Nigeria, Kenya, Indonesia, they will speak to some of these issues. For example, estimating coverage is difficult because there's a lack of lists of public spaces, no clear definition of public spaces. Sampling is difficult. Even estimating coverage within one space is difficult because there are no good metrics yet. There are so many different kinds of public spaces, different opening hours, some spaces without a clear entrance, no harmonized norms and indicators, just very challenging. And it also makes it very difficult, of course, to compare data from different countries, because basically they rarely measure the same thing. So the first bit is on the mapping of the methodologies used by these monitoring tools. So this is a table that just describes the methodology used for each of the tools. The Hand Hygiene for All partners have shared 12 data collection tools. And so I have 2 slides here. And so let's quickly look at the first line, which is actually on Nigeria, the WASH norm survey. We see the data collection method, which in that case is in person with official enumerators, the main measurement technique, spot checks, and some indirect reports. Who responds to the questions? When it's a spot check, it's a surveyor. If not, it's a WASH committee, the scale, and so on and so forth. So this table basically describes the monitoring methodology for each of the tools. And although we see a lot of in-person monitoring by official enumerators, if I go to the next slide, here we have a few more examples. For example, looking at Myanmar, it is remote monitoring using a public mobile app that is used for to conduct a survey among hand hygiene facility caretakers. So very different, different measurement technique, also different scale, and different even when it comes to what kind of public spaces are monitored. And so this is the start of the mapping, just trying to flesh out what are the differences when it comes to the different methodologies. And when we try to visualize that, that is done on this slide, we can make a chart like this. For example, we have here the data collection methods in the headings, the columns, and the measurement technique in the rows here. And so, for example, we go from something what is like a online survey, the top left box, online survey using self-reported data, all the way to bottom right corner in Zimbabwe, where official surveyors are using structured observations. So, you know, one is of course not better than the other. Everything depends on the purpose of the monitoring. It's very different. Also, the transaction cost of collecting data, of course, is very different between these two. And we have everything in between, from other kinds of remote monitoring or other kinds of in-person monitoring. And so the whether or not the monitoring activity is feasible will depend on many elements, such as the cost, the available time, the purpose, the skill. And so I think that is one of the conclusions of the mapping of these 12 monitoring tools, is that the methodologies vary very widely. The data collection method, the scale of deployment, the measurement technique, the respondent, and the scope differs a lot. And the choice of monitoring approach will, of course, depend on the purpose. Well, we just discussed that. Most tools use a data collection method with official surveyors who physically inspect sites. So let's say traditional. The spot check is the most common measurement technique, maybe not so surprising, followed by indirect reports. There is a lack of information when it comes to the sampling and selection strategies employed by the tools. Most tools don't give any information on this element. And so even though I have to say the information might be out there, that is one of the limitations of this review, is that it might be more comprehensive if the people who designed the tools could provide more details. But for example, when it comes to the sampling strategy, often no information, and so that makes it very difficult to do a good gap analysis or to estimate coverage, let alone have representative data at national level, for example. And finally, I think the mapping also shows that there is still limited information on the strengths and weaknesses of some of the measurement techniques, mostly some indirect reports used in Myanmar, for example. That is information provided by caretakers of hand hygiene facilities, and also of limited observations of practices, for example, Indonesia. But interestingly, I think the team from Indonesia will discuss that. So this was the part on the mapping of the methodologies, and we can also map the content of the tools. And to map the content of the tools, a simplified results chain has been put together based on 6 existing frameworks. And so I think, although we can discuss whether or not some concepts are rightly positioned within this framework, this is merely designed just to map the content of the tools, and it is definitely not a theory of change, for example. And just notice that the outputs are broken up into 3 different levels: psychosocial factors and capabilities, and then infrastructure and consumables, and also hand hygiene, the management of the facilities. I have also tried here to include some determinants of hand hygiene practices by using the behavior-centered design framework. And you see that at the bottom, for example, the behavior setting, the brain, body, the environment, and the external context. All of those are determinants that are part of a framework of the behavior-centered design. And it can be interesting to include that because in theory, within the peer-reviewed literature, we see assessments of which determinants are most important and which play a role larger compared to some others. And so it can be interesting to include that. Now, if we go to the next slide, here we have simply mapped the focus of the tool. So what are they looking at when they monitor on this results chain? And some findings here, they pop out, of course, because most tools will actually look at the output level, and especially, of course, infrastructure and consumables. That basically is, is there a facility? And is there soap, is there water, things like that. Also, the management of the hand hygiene facilities in different ways is also often monitored through these tools. To a much lesser extent, practices and when it comes to psychosocial factors, almost none. Inputs are monitored by the tools, and maybe not such a big surprise. I mean, the enabling environment or the impact are not monitored by these tools. And so if we describe that in terms of the determinants for hand hygiene, I think we can say that the large majority of tools focus on the behavioral setting. So what is there, what is available, how is it managed? And yeah, that is, I think, the focus of most tools. The report itself looks at the content of these tools with more detail. So every part of the result chain is then broken down, and we look at how many measurements are looking at, for example, functionality or accessibility. And so I think the conclusion of that more detailed analysis is that among the outputs, the availability and accessibility of the hand hygiene facilities is measured most. And with the exception of one tool, the quality and acceptability of hand hygiene facilities are not monitored a lot. Neither is adherence to other COVID-19 hygiene measures, such as physical distancing or things like that. There are various other elements of the results chain that are not or barely monitored, such as functionality, cost, sustainability, and hand hygiene skills. I think this is simply because, well, as a result of the purpose of these tools were not designed to look at these elements. So it's not this conclusion does not say that these tools should have looked at these elements, but it's just a finding of the mapping. Part 3 discusses the quality of the individual measurements. Now, in order to do that, there are 3 criteria that are used, though I think the focus is on reliability and validity. And so this section will explain how each individual measurement has been rated, looking at the reliability of the measurement and the validity. The potential for bias is discussed also, but to a lesser degree. I think that's, it's very well known what are the potential, what is the potential for bias based on the measurement technique, and with self-reports and with observations. So the report doesn't focus a lot on that. But let's quickly look at reliability. I see I have a little bit of time, so let me spend 30 seconds at least to talk about reliability here. It's concerned with error in measurement. It's quite interesting. It refers to the extent to which a measure is the same each time it is performed and by whoever performs it. And then there are 2 parts, test, retest. So imagine you go back tomorrow. To what extent will you record a difference compared to today, for example? And then there's the inter-tester reliability. Will 2 enumerators draw the same conclusion using the tool if we put them in the same situation? So that's really interesting, and we will see that many measurements have issues with inter-tester reliability. Validity is a little bit more tricky because it is about the extent to which the question generates useful data with regards to the intention of the measurement. So let me give a very easy example. Is a self-report on hand hygiene practices a valid measure of actual hand hygiene practices? Well, that's an easy one. We can say, no, it's not really a valid measure. But we will see many examples where it's not so clear what the intention of the question is, and it might be difficult to rate the validity of such a question. Let's take a look at the results, and then we will go into a few examples. But please refer to the report for a longer list of examples. But here we have a little chart. You see the bars show the average score for a specific measurement technique. So let me use the first here, the indirect report, the reliability score, and there are 23 of those among the 12 tools, is around 2.5. But the blue and the orange dots, they show the variation. So what is very evident from this chart is that there is a lot of variation when it comes to the quality of measurements, and we will see that is the case within measurement techniques, but also within tools and among tools. Just a lot of variation when it comes to the quality. So that's, I think, one of the conclusions here. And for example, let's look at the right of this graph where we see the spot checks. Very interesting that the validity and reliability of the spot checks vary widely. Let's take a look at some examples, and then I think maybe it will become clearer. So this is an example of reliability. Here there is a question in a spot check actually in at the top. I will read it out loud. Hand washing basins are functional without any blockage and free of dust, stain, and litter. Now you have potentially inter-rater issues here because there are so many concepts and some will be quite subjective. Dust, stain, blockage, and so potentially a lot of issues, specifically inter-rater issues with this question. And one which is much more straightforward is the one below here, another spot check. Please indicate if there is soap available for use. And then the options are bar soap is available, or liquid soap is available, or soapy water is available, or no soap is available. It's difficult here to have inter-rater issues. It's difficult to get confusion between two different enumerators. So not a lot of issues here when it comes to reliability. Let's look at one example for validity. For validity, I use the same example here again, the hand washing basins that are functional without any blockage and free of dust, stain, and litter. Well, if the answer is yes, what do you know? What do you know about that hand washing basin? If it's yes, not a lot, because maybe there's a functionality issue. Maybe it is functional, just a bit of dust. So the intention of this question is not really clear, but it's not really a valid question for example, stain or litter, because if I say yes, it might be simply because there's a problem with the functionality. So validity issues with this question. Another example below, that is an observation of a hand washing event. Is soap used to wash hands? Well, the intention of this question is really clear. And also, it's a valid measure. Is soap used, yes or no? That's interesting to know. And so much less problems here with the validity of the question. Yeah. So for more examples, well, I have a few here. I can't go through all of these, but just suffice to say that either there's some issue with the question or there's some issue with the response option, which makes that the question has some reliability, potential reliability issues or validity issues. And I have to add here, this is a big limitation of this review, is that context might matter a lot. And when somebody looks at a question without understanding the context, we might not understand the intention. Well, actually, it may be in a specific country, it makes a lot of sense to ask the question the way it's phrased. So bias, I will not discuss, let's say, the potential for bias for observations or for self-reports. I think those are everybody knows about that. What is maybe interesting to mention is that often when we talk about self-reported data, it's about practices, but the tools, when they use self-reported data, here it's often about a responsibility. So for example, they ask the caretaker of a hand hygiene facility, When was the hand washing facility last cleaned? Are leakages fixed at regular intervals? Are taps and basins regularly disinfected? So this is self-reported data about some responsibility, and there might be a potential for bias there, giving socially desirable answers. I don't know if we know a lot about the type of bias here. It might depend on so many factors, but it's interesting to see this type of self-report in the tools. Let me move on. So if you would, look at the average scores per tool, you see that in general, the scores are not very high. And also between the tools, there's a lot of variety when it comes to the strength of the measurements. We see that the one for Nigeria is the norm survey in Nigeria scores highest, and that there is also one used in Zimbabwe and Lebanon, which scores over more than 6. So, but in general, maybe low average scores. Indicators and data. Well, I only have 30 minutes. I will not spend a lot of time here, also because the presenters after me, they will be presenting the data of that was collected using the monitoring tool. I will say a little bit about indicators here. Most tools actually were not accompanied with indicators, and when indicators were available, they can't be compared because they address completely different levels of the results chain. So inputs or psychosocial factors, or the availability of hand hygiene facilities. So these simply cannot be compared. It doesn't make any sense. And that's also an interesting finding. Shortly about the data, only 4 tools had data sets publicly available. I already mentioned no common indicators. Sometimes the validity of the indicators is unclear. So maybe data can be shared. Maybe we'll obtain more data, but at the moment, it's very hard to compare the data. That leads me to the summary of the findings of this draft report. I will just repeat quickly, starting from the top, the monitoring methodology. We've seen a lot of variation in the methodology, a lack of information on sampling and selection strategies. And as a consequence, it would be challenging to estimate coverage or do gap analysis or collect representative data. And there is some there's maybe limited information available on the strengths and weaknesses of some measurement techniques. When it comes to the focus of the tools, most focus on the behavior setting, some on practices. I already mentioned this, that the quality or acceptability or convenience of the hand hygiene facilities are barely ever monitored. The quality of measurements, well, we just discussed it, a lot of variation among tools, within measurement techniques. What is interesting maybe to mention is that among the 92, let's say, measurements, so all the questions, spot checks, observations combined, there wasn't a single one that was the same. So even if you look at, for example, the spot check on the availability of soap, it will never be the same. Either the response option is different or the question is different. So that's very interesting. And then I just discussed the issue we have with the data and the indicators. Which brings me to the last slide of this presentation. So the next steps, well, there will be some feedback on this report that has to be incorporated. The report is now available on the JMP website, the draft version. And if we look at the original TOR, there is a proposition to draft common indicators and to draft template monitoring tools. I think, Rick, this might be interesting to see to what extent this review concludes that is possible. If it's necessary, maybe we can discuss it also during the discussion later. But that's it for my presentation, Rick.
Thanks, Peter. Thanks for a nice presentation. There's a lot of information there, and there's a lot of information in your report as well. So I think people will want to take some time to read it and digest it. But it's a very nice summary. I think your structure is very clear, and you've highlighted that there's a lot going on. So we have a lot of activity in this space. 92 different measures, but never using the same measure more than once. And so a very long way to go in terms of starting to harmonize and to standardize and to enable any kind of cross-country comparison or comparison of trends over time. But we do have some very nice examples. I'm sure our participants also know of other examples that have not been included in the review. So I think we'd really encourage people to share those and to continue sharing them as we build up our database of existing tools. But in the meantime, I think we'd like to now hear from 3 country case studies. And we're going to start with a case study from Nigeria. I'd like to ask Peter Adenekbe, who is with UNICEF in Nigeria and has been doing some work together with the National Bureau of Statistics and the Federal Ministry of Water Resources. Peter, can you hear me? Can you?
Yes,
speak?
yeah, I can hear you. I can hear you.
Fantastic. You have about 10 minutes, Peter.
All right. Okay. My slides should come. Okay. Yeah. Good day, everyone. Yes. Just to follow up with what was presented. So this is just the experience so far since 2018. So based on our WashNote survey, is annually collected. So next slide, please. Okay, now our first outing was 2018, as I mentioned. Just a preview of what we did. In 2018, we actually commenced the survey, which include household surveys, public places, health centers, and education. But we restricted our coverage within an enumeration area, which we all know that it's not a big geographical space. It's a little bit small. So our protocol, we restricted the enumerator to work within the enumeration area, having in mind of using the EA frame to estimate the number of public places we have. And also we have in back of our mind to also manage fund. The fund was not fully available at that time. And after we finished the survey, we realized that we could not proceed after we estimated at national level. We could not disaggregate it at sub-national level across all states. It means that we can also refer to national, not at sub-national level. So learning from, next slide, please. Now, learning from our challenge we experienced in 2018, we decided to do an independent frame, which we don't have, which we did not actually develop in 2018. So we do an independent frame. So all states, with the help of the National Bureau of Statistics, which also a pilot agency of this WashNote, we were able to develop a frame of all the multi-parks and public places, motor parks, and markets. And the basic information we on that frame was we named the name of market, then locality or community they belong to, and the address and the local government. Now, what we now did is to put them in cohorts in terms of proximity or those that fall within the locality, and employ the adopted the systematic sampling techniques to select our sample. So why systematic sampling? Why do you choose this among other kind of sampling? Because we want to maintain spread of our sample. And we're actually interested in representativeness of those sample. For your sample to spread across, I think the best form of sampling techniques is systematic sampling. I know if you use simple random sometimes is skewed. So we don't want to have challenges of representativeness and all that. And to also ensure that every cohort, they have their representation in terms of our sample. Next slide. Now, these are basic information we asked during the survey on specifically to hygiene. So we have two types of questions. Question that we get responses from whoever that is in charge of the facility. Then another kind of response is the one you observe and record. So in terms of basic sanitation, for example, for you to be able to collect data on whether the soap, there's presence of soap and water currently available at the hand washing facility. This is by observation. And as well, the evidence of use of that hand washing facility is still an evidence base. So there must be a kind of evidence of dampness, of use, and maybe all other form of evidence that you found around there. This question is not directly to the respondent any longer. Is this the responsibility of the research assistant to also detect? Next slide. Good. Now, this is the results of the survey. Now you can see at national level, the no service is 92%. And if you compare it, the urban and rural, urban have more, in urban setting, we have more access to hygiene facilities than when you compare it to that of rural. Moving away from that, you look at markets and motor parks. So markets have more of access. There's no significant difference anyway. And we record 58% of markets remarkable with hand washing facility, with accessible also to public people living with disability. Now we hope that we just concluded with the data collection of 2001. We hope with this pandemic, there will be a kind of increase in terms of usage of the hand washing facility in public places. Next slide. Next slide, please. Okay, now we observe this. Since our response to the usage is based on evidence. So there are classes of activities in public places. There are public places that is there on a daily basis, like markets, like motor parks, for example, is on a daily basis. There are some markets that are, there is a kind of a specific day of the week. It's called it traditional the week. They normally go there maybe after their harvest, they come back there maybe once in a week to do that. So in weekly is they have a specific day of the week. If it is every Thursday, they all gather there, do their transaction and leave. So if you look at the distribution in terms of evidence of use, so there is a likelihood that those that have once in a week may not actually capture properly, let me put it that way. Like on the day we have more of sample, which is 75, and the evidence of use 65%. If you look at the distribution across the class of activity, you find out that there's no significant difference. So what we are looking at as a point of visit, if the market is not operational, it means that that particular facility will not be accessed. Or if at the point of visit, there's tendencies that those who in charge of the public places might not also be present. Then another thing we may also, information that may mix out, because since it's a long-term gap before another activity comes up, there's every tendencies that evidence we specify in our questionnaire might not be there. For example, the dampness might dry up, there might not be water to also show that they are using this facility. Maybe everywhere is covered with dust until the next market day. So while we are comfortable with it, we actually realize that our response rate was very, very encouraging. At least we have up to 95% response rate. And when we look at the classes of evidence of use by class of activities, there is no really significant difference for what we capture. Next slide. Now, we look at experience in terms of the critical. Now, having a critical committee is also a factor of size of the public places. Majority of the public places in market and motor park, they have a union, they have association who is in charge of all activities within that space. But where you can see a dedicated wash committee in public places are those that have, one, the activities on a regular basis every day, then two, probably the size, then looking at, there are sometimes they have up to 5 or 3 section of where they have sanitation and hygiene facility in place, probably for monitoring of revenue. They use it as a form of revenue generation, whereby when you access, it is minimum of 20 naira you charge, you put it, then you use the toilet, you make use of the hand washing facility just for sustainability purposes. So you can have that structure. But however, in absence of wash committee, the critical committee that take care of the general public places take charge of the wash facility. Next slide, I think that is our experience from Nigeria.
Thank you very much, Peter, for a nice presentation. And one of the things that I found most interesting was the approach that you took to sampling and developing this comprehensive list of markets and motor parks. I'm sure people will want to ask questions about that later on. I can see people are starting to type in the chat, but please keep posting your questions. We're going to move to Indonesia now, and we're going to hear about the 3M initiative from Mitsu and Prita. Over to you. You have 10 minutes.
Yep, thank you very much. My name is Mitsu. I'm from WASH team in Indonesia country office. And I'm with Prita, my colleague, who will present the last 3 slides. Here we'd like to kind of share our 3M initiatives. So next slide, please. So first of all, what is the 3M strategies? And 3M stands for the Indonesian word. You can see 3 M's. So including hand washing with soap, proper mask usage, and keep safe distancing. And this is really kind of observed to be very effective in terms of risk reduction for COVID transmissions. And Indonesia government really put effort to emphasize these 3 key hygiene behaviors. Next slide, please. Yep. So what we are monitoring, so we have a simplified kind of monitoring questions looking at the public places. So starting from locations and then identified locations. So we are looking at schools, religious place, transport stations, public transport stations, traditional market, or modern market. And then for the hand washing part, so first we are looking at the availability of the facilities or hand sanitizers. So we have a kind of 3 categories: fully available or partially available. Partially available means a lack of water, soap, or both. And then lastly, not available. And in terms of a practice, as Peter mentioned in his presentation, it's kind of grouped indicator. So looking at the 10 people observed, and then how many actually wash their hands. So it's the answer will be somewhere between 0 and 10 people. And then I think kind of one interesting part is the enforcement. So we also looked at, was hand washing practice supervised or observed at the entrance. And we felt that this enforcement piece would be important to make sure people actually wash their hands. And I'm going to show the result in the next slide. But we felt, go back again, sorry. Yep. We feel that the enforcement is important piece. And then similarly for mask and safe distancing. So it's about 10 people observations and then enforcement. Next slide, please. Yep. So here, it's really about the enforcement, and just would like to share some results. So left-hand side, you can see proportion of people observed washing their hands with soap in percentage. And then you see 3 different types of public spaces: religious places, public transport, and market in the right-hand side. And then different colors tells you that, the supervised or not supervised. And yellow bar shows 95% confidence interval. That would tell you, the kind of a statistically statistically significant difference. So as you can see here, all types of public spaces with the supervision, we see the higher rate of hand washing practices, and the kind of highest difference was observed in marketplace, which kind of makes sense because in marketplaces, if people supervise or enforce you to wash their hands at the entry point, then more likely to wash their hands. So that's kind of supportive. But also when I analyze the school data, its kind of pattern is a little bit different. So maybe for school case, which is not open, and need kind of different interpretations, but overall, the same patterns are found in mask use as well as the safe distancing as well. Next slide, please. Yep. So just to show you how we kind of report. So you can see from left, sorry, just putting the, it's kind of quick, but you can choose who you are, and then location will be selected based on geotag via WhatsApp. And then you can, select the locations, and then this is the type of public spaces like schools or religious places. You can put number, and then hand washing facilities. So you can choose 1, 2, 3, like a fully functional, partially, and not available. So it's very simple. You can just type in, for example, 1, and then next question will come. So how many people wash their hands? So 8. So quite simple way of reporting. And then also with the data team support, the dashboard is available. So you can see the map of the Indonesia and then the data and results as well. But one tricky part is again kind of back to the sampling strategies part, and this is not really structured kind of sampling. So when we present these data, then we have to be careful to say that this is not representative, and then also kind of the coverage of the data varies across the locations, right? Across Indonesia. So we have to carefully use those data. So now pass over to Brita for next slide. Thank you.
Thanks a lot, Mitsu. And good morning and good afternoon, everybody. So to take off from where Mitsu left off, the reporters we have as part of the 3M monitoring initiative are volunteers. So these are mainly citizen reporters from the general public or the frontline staff of the COVID-19 task force and NGO partners. But essentially all of them do these observations on a voluntary basis. And the advantages of this model are that one, we are able to tap into a potentially large number of observations as the volunteers cut across different segments. Next, through this data collection, we are able to raise public awareness among the volunteers itself. So the more observers we're able to engage, that many more people's behavior we're able to influence. And this comes as at a minimum cost. So all we're looking at is cost in terms of training these volunteers. The disadvantages are in terms of, because these observations are done by volunteers, there is a lack of predictability. So there is no guarantee that the volunteers will continue the observations beyond a certain period of time. So we've seen that the number of observers or the observations vary from month to month. Also, the data points vary in terms of locations and the time period. So again, the data is not always representative of a certain population or a certain location. We have seen that we need to put in a lot of effort to ensure that the data that we're collecting is accurate and dependable data. So there's a lot of data cleaning process that needs to go on a continuous basis. Can you go on to the next slide, please? So some of the larger lessons we've learned through this initiative is that institutionalization of the tool within the national system is key in order to engage government structures and their frontline base who are already incentivized. And so these, so it can have a larger impact in terms of coverage. Also, the findings and the recommendations can more widely and systematically be disseminated for uptake by the local government and decision makers, and therefore be able to inform or influence programming in a bigger way. I've said that the reporters are volunteers, but when we initially started this whole initiative, we had started it on an incentive basis. So we had engaged the National COVID Task Force volunteers, and then so we were paying them a certain incentive. But then we learned along the way that it was not sustainable at all, and the only way to do it was to really have it integrated into ongoing hand washing and COVID-19 interventions. Also, one of the lessons is that while a one-off training is not important, is not enough, because there are a lot of challenges on the field that the reporters come back with. So we need to have regular training refreshers to be done, and so this involves a training cost that needs to be invested and factored in. And also, there's more to the data than the numbers. So qualitative analysis is important. So, for example, to really understand that a family moves together. So in terms of safe distancing, it's not always possible for them to practice it. And they also see it as a way, to protect themselves from the larger public. So you find a family really sticking together and not really practicing the safe distancing indicator. Also in terms of, so we've also seen like in a province which has 97 to 98% levels of hand washing practice, for example, the COVID cases are really increasing in that province. So to really understand why this is happening and what are some of the other risk behaviors or risky indicators that are involved. So qualitative analysis is important to really understand the behaviors. Can you move on to the next slide? So in terms of scaling up and next steps, what we're doing is we've partnered with the WASH cluster members who are NGO and implementing partners to really increase the coverage of 3M monitoring. We also have private sector partners on board through whom we're trying to promote the 3M monitoring to the larger general public. And we also have, through universities, we've partnered with the Association of Health Promoters through whom we're implementing this. What we're also doing is, so in Indonesia, there is a national COVID task force monitoring system, which is already in place. So we're trying to integrate our hand washing indicator within that system to have access to a larger number of volunteers and to be able to get a larger scale of hand washing data in that way. We're also trying to strengthen our evidence base through youth engagement. So through one of the universities, we are entering into a strategic partnership that will reach out to 40 universities. And this is underway. And this is also to really see how youth engagement can really help in also promoting the hygiene behaviors and how the youth can become powerful agents of change. And this is something that we're trying to also do in schools to see how we can use 3M monitoring as an entry point for hygiene behavior change interventions. So let me stop here with this and back to you.
Okay, thank you, Preeta, and also to Mitsu from the Indonesia team. Very nice example, very different from Nigeria. Crowdsourced data and a large amount of data, also using data collection as a means of raising awareness. Our last case study example is coming from Kenya, the MBCC initiative, and we're going to hear from Dennis Munai, who is with AMREF in Kenya. Dennis, can you hear us?
Yes, thank you, Tom.
You have about 10 minutes, Dennis, please. Thanks.
All right, okay. So I'm going to talk about some of the lessons that we learned from the design, distribution, and assessment of public hand washing facilities in the country, in Kenya. And this was an initiative funded by UKAID and Unilever, and was implemented by, of course, through the Hygiene Behavior Change Coalition. So next slide, please. So the presentation will take us through the introduction, the background, issues around the tools that we used during the deployment, assessment and evaluation, and then I'll talk about the results and findings, and then some of the lessons that we learned and recommendations from the whole initiative. Next. So, so the background and the context of this initiative was that the first case of COVID was reported in the country in March 2020, and of course, as any other country, the government of Kenya placed in some of the measures, for the prevention of COVID-19 or the rapid transmission and the community transmission. And these, of course, involved most of the initial things that measures that were placed in all the countries around the world. So one of these was around looking at hand washing practices in the country. And from this initiative, some of the partners, of course, including AMREF and some of the private sector partners, came together under an umbrella called the National Business Compact on Coronavirus. And one of the mandates was accelerating, again, local action through distribution of hand washing stations. Again, just to take you back, was that at the onset of COVID-19, the government of Kenya quickly came up with and they identified 7,000 plus hotspots that were classified as hotspots for COVID-19. And all these hotspots were in public spaces. And from these, the NBCC initiative covered 5,311 hand washing points through the distribution of hand washing stations. And these, of course, were done in 3 phases, for the first phase looking at 20-liter capacity hand washing station. Second phase was issues around 60-liter. And the third phase was a 100-liter capacity. Next slide. Yeah, so talking, of course, when we were doing the distribution of these hand washing stations, some measures were put in place to ensure that, one, the hand washing stations reached the beneficiaries as intended. And through these, the NBCC initiative secretariat came up with sort of like a technical working group to look at the hand washing station deployment. So each partner, so the distribution happened through, were conducted through partners, and each partner, of course, had an inventory of all the hand washing stations that were supplied, and they were also required to undertake issues around replenishing of the consumables as water and soap. And we had weekly meetings, and these weekly meetings, we served sort of like a routine monitoring initiative just to look at issues around location stability, usage, and functionality of these hand washing stations. And of course, the information that were collected were issues around usage tallies, random users surveys, and geomaps through a partner called MapWash. The information that were collected ranged from basic to secondary information. On basic, some of the information that we collected was issues around usage, the operational cost of these hand washing stations. And of course, from that, there were issues, recourse that were implemented, recourse measures. The secondary information that we collected were issues around community buy-in, the geo-proximities, coverage, and the community profile. And from these, again, these informed the phased approach of deployment. So next slide, please. So within, so I mentioned that we had a 3-month deployment period. And from these, after 3 months, we realized that, yes, we had distributed close to 5,000 plus, the 5,300 hand washing stations. But then we needed to learn from this initiative. And from this, we thought, why not conduct a rapid evaluation, look at, one, the status of these hand washing stations, their functionality, how it's being used, accessibility, and issues around maintenance. And of course, from this also look at enablers and barriers to the use of these hand washing stations. And from these, again, identify gaps, the existing gaps, and use this to inform either redeployment or issues around how to best, just learning through this. So we conducted a cross-sectional study with a mixed data collection methods, and this covered 5 Kenyan counties out of stroke regions, out of the 47 that we have in this country. And the map on your left looks at the geographies that we collect when I took the study in. Next slide. So from this, again, I had mentioned that we collected information on usability, functionality, accessibility, and issues around operation and maintenance. And we collected information on various ranges. So we spoke with the caretakers, we spoke with the users of these hand washing stations, some of the non-users, and of course, observed and examined the infrastructure itself. We had purpose to collect information from 430 hand washing stations, but from the 430 that were random sample, we were able to only locate 316 hand washing stations. And of course, some of them were missing because of various reasons. We saw data collection tools, spot checks, caretaker survey, observations, and user exit surveys. And we also used qualitative methods for data collection. So FGDs and the key informant. Next, please. Next slide. Yeah, so some of the key findings, we grouped these into various categories and thematic areas. So there were issues around functionality, And from this, you can see that close to 90%, 85% to 90% of these hand washing stations were functional. And we grouped this around whether the taps there were no leaks, whether the taps were functional, they could be easily open, whether the tank had water, there was a soap there to be used by the community. Again, we found out that because these are public spaces, so obviously most of the users were adults, so between 18 ranges between 18 and 59 years old. Again, to mention and to take you back was that it was also the intention of the NBCC partners to use the hand washing stations as also information centers. So places where education materials and education on the COVID-19 prevention measures could be propagated. And from these, we found out that only 45% of these hand washing stations had IC posters. And in terms of maintenance, we found out that close to 80% of these hand washing stations had caretakers, people who would be responsible for ensuring that the water levels are as recommended, that there was soap that was available every day, and that information were being passed on a daily basis. So next slide. Yes, so in terms of accessibility, we found out that close to half of these hand washing stations could not be reached by people with disabilities or persons that were on a wheelchair, and that close to 61% of these hand washing stations, of course, again, were visible or nearly in a public setting. So you could easily visualize it whenever you are, so you could easily find it. On issues around use, so this was also observations. So 84% of the observed users used soap and demonstrated the correct technique as recommended by WHO, and also that close to 96%, so 100% of these observed users wash their hands independently, but the ones that were not observed needed some help was supported by some of the caretakers, and the issue was issues around maybe opening or closing the tap, which we found was a small number of users. So next slide. So some of the enablers and barriers that we identified during the study was issues around the fact that there were hotspot areas that had already been identified by the public health, by the Ministry of Health, and most of the partners that we engaged used this criteria in regards to the distribution, the deployment of the hand washing stations. Again, back in March 2020, there was a national campaign, and this national campaign was mostly talking about hand washing in public spaces. So whenever you're in markets, before you enter a market, you have to wash your hands. As you leave the market, you wash your hands. Going into a supermarket, going into a shop. So that campaign also helped propagate the information around hand washing. The other aspect was, again, listening to the users and using the routine data that we're collecting as NBCC partners to adapt on the design features. So issues around the adapting on the capacity of the tank, use of pedals and the likes. Again, we worked very closely with partners who had infrastructure in the community, existing infrastructure, and these of course helped in the rapid deployment of the hand washing stations. Again, the evolving nature and the beautification that we undertook on the IC materials again was something that worked on our favor. In terms of barriers, there was issues. The major barrier was issues around heights, appearance of the soap that was sometimes dirty. We had to adapt on the drainage system. The IC materials again had an issue here and there. But also the issues around operational maintenance. Some of the caretakers were not enabled to, could not be able to work on a daily basis because they were not paid. Some were paid. So next slide, please. And of course, we had some lessons on the design of the intervention, and these, of course, issues around when you are designing an intervention. So public spaces are very important. Make sure that you define a public space well in advance. Issues around there are different challenges in public points, and then again, deploying when you are undertaking rapid deployment, then it's important to use existing management structures. Again, the caretakers that we used, we also found that there were challenges here and there in regards to understanding information and propagating the information that we wanted to be propagated. And then use of foot pedals for water and soap. So these, again, conserve usage and reduce the risk of touch points. Next, please. So in regards to deployment, again, the use of existing networks, it's important to undertake formative research to understand issues around safety, capacity, heights, and the likes. It's also important to really think through the sustainability measures in regards to continuous supply of soap and water. The communication materials, again, that's very, very important to ensure that you have IC materials that are catchy and can be easily be read. And there are different codes in a population. So the elderly persons with disabilities. So these must be considered right from the outset of the design. Next slide, please. So I'll now, in closing, issues around the tools that were used. We found that we had an issue with the data collection period. So we were limited by the time that we undertook this study. So we should have done it much more time. So the issues around understanding the dynamics of the different public spaces, that again is a lesson that we learned, and we should deploy on that. Again, the form of data collection from users and non-users should be determined for different levels. With some of the exit interviews, some of the questions we found that they were challenging. And finally, issues around we were unable to observe in some public settings which were more active in certain hours, because of course these are rural areas. So you'd find that very early in the morning, you find that there were few users. During lunchtime, because people are going to shops for shopping, then you find more users in the evenings. So during data collection, we had a challenge with that. So we had to time ourselves better. So other than that, yeah, that's my presentation. So yeah, thank you so much.
Thank you very much, Dennis. It's a very nice case study and a very interesting analysis of the challenges of data collection in the context of Kenya. I'm going to pass now to my colleague, Rick Johnston, who's going to facilitate a discussion around some of the issues emerging from these presentations. Rick, over to you.
Thanks very much, Tom, and thanks to all the presenters for a lot of thought-provoking inputs. I've seen that there have been a couple questions already in the chat, so I'm going to draw on those, but I encourage people to continue adding your questions to the chat. We'll try and answer them online if we don't have time to answer them in person. But I want to raise one theme for all the different participants, including those who haven't made presentations. And that's that a lot of the work that Peter did in his review was based on tools that were developed and used in the early stages of the COVID pandemic, or even prior to COVID-19. And Nat, in his opening remarks, mentioned that attention is fleeting. And I'd like to hear from the participants in this webinar about hand hygiene in public spaces where you are living, in your countries. Is this still an issue? Is it a priority? Are there signs of sustainable programming around hand hygiene in different types of public settings? Or was it more an initial burst of enthusiasm and panic related to the early days of COVID that hasn't really proven to be a durable initiative? So I'll ask that along with the other questions specific to each of our case studies, and then open the floor to anyone else who has a comment on that. But let me start first with one of the questions for Peter. And Peter, this is coming from Haitam, who's with the Global WASH Cluster, who asked about references to distance. He was interested to know if you had found any tools measuring the physical distance during hand washing or social distancing in general. So this is the distance between people as they're queuing. And he had a related follow-up question about crowding and long waiting times, if you had found any examples of that being measured or counted as a barrier to hand washing, or if it was just absent during the tools. And before I ask you to respond to that, I'll also raise to your attention that we've had a couple questions about accessibility. There was a question to the team from Nigeria about persons with disabilities. And we also heard from in Kenya that less than half of hand washing stations were accessible to people in wheelchairs. So let me just ask you to reflect, if you can, quickly about if you found examples of physical accessibility in the review that you made. Over to you, Peter.
Thank you, Rick. I think the Indonesia example, 3M, might be the only one where, aside from hand hygiene, they looked into other COVID-related measures, such as mask wearing or keeping, distance. And if not, aside from that, in some of the tools, accessibility was monitored. And this mostly had to do with the location of the hand hygiene facility within the space. So imagine there's a bus station, and how do you get to that facility? Is it visible? And then otherwise, yes, it related to the accessibility for people with reduced mobility. So I think there were maybe 4 or 5 questions among the 92 that definitely looked at accessibility and not so much COVID measures.
Okay, thanks for that, Peter. And in fact, maybe we can turn next to the Nigeria team, where this question was actually directed. So let's see, Peter Adenegbe, we had a question from Bozire Moraro, asking if you had any criteria about accessibility of hand washing facilities for persons with disability, and if so, what it was that you looked at. Peter?
Okay, thank you so much. During the training, though the criteria was not put down in the questionnaire, but during the training, the enumerator were trained to observe if the facility have a ramp where those with wheelchair can really roll in, and also consider the height of the facility for their hands. If it's reachable to with people with disability, then it can now indicate that the facility supports people living with disability. Thank you.
Thank you. And I see that in the chat, we also have a comment from Jonathan in UNICEF Nigeria saying that this was a national survey, so the indicators were along the lines of the SDG measures for hand hygiene. So I don't know, Jonathan, if you wanted to elaborate on that. You're saying that the results were actually measuring how well the nation was making progress towards meeting the SDGs. Does that mean that you're including these public settings in your assessment of Nigeria's progress towards the SDGs? Oh, let's see. Actually, Jonathan, I'm going to need to unmute you.
Okay. Can you hear me?
Yeah,
I was just able to unmute myself here. So I was making that comment in response to Hitam question around how did we set the targets for this, and just to respond that, given that it was a survey at the national level, there was really no target per se, but the indicators were really drawn from the definition of hygiene as contained in the SDG, and of course part of the JMP's definition as well. So we were not really looking at what targets are we achieving as per the annual survey, but also looking at how well is the country making progress in this regard in terms of meeting the standards for hygiene, and also in terms of the availability of hygiene services, both at the household level, even though we are not focusing on that in this webinar, but also in public places. Because as we know, except it is available at both levels, at the household and in the public places, then of course we are not making enough progress as the case may be. So I just wanted to clarify that. And result from this survey is really helping our programming. And I'm quite glad that on this call, we do also have the consultant that is working, supporting the Federal Ministry of Water Resources in Nigeria now to develop the hand hygiene roadmap. So we're now using the result from the norm survey in terms of the levels of hand hygiene in the country, reflecting that as we are developing the hand hygiene for all roadmap at the country level. Over, thank you.
Thanks so much, Jonathan. And actually that links to the follow-up question I wanted to make to Peter. Maybe either or both of you could answer that. And that's about the sustainability of this initiative. And actually this norm survey came before the COVID experience, but it's great to hear that it has been useful in assessing the response to COVID. But do you think this is something that will become institutionalized and regular, or was this kind of a one-off example? And just what do you see as the future for monitoring hand hygiene in public spaces in Nigeria?
If I may jump in there quickly, I think this is something that has become institutionalized in Nigeria now. In fact, for this year, the questions for WASH in general, but more specifically for hand hygiene, is no longer being done with mix. So norm data is now replacing that in Nigeria. So the government has taken this up for the current round of norm for 2021. The government is actually funding it almost 100%. And the data from norm is now accepted nationally as the most authoritative source, if you like, for norm, for WASH indicators and WASH information. So we see this not as a one-off thing, but something that is going to continue. And given the level of acceptability that it has received in the country, and with the National Bureau of Statistics and the Federal Ministry of Water Resources anchoring it, we see it as something that is going to continue into the future. Whether it will be done annually is something that is still being discussed because of the cost involved and also the amount of logistics that goes into planning such a big survey. But the government is still discussing this to see if it can now be done at a regular interval, maybe every 2 years or every 3 years, in such a way that the data from it is relevant enough and not too old before another survey is done. I don't know if that answers your question, but we see it as something that has come to stay, more or less.
No, that's great to hear, and I think it's another good practice to be firmly integrated with the National Statistics Office to ensure the sustainability as well as the quality of the data that are collected. Let me pivot from Nigeria to Indonesia then. I'll ask Mitsu and Prita also to reflect on the future, but we did have a couple of specific comments in the chat, one from Edwin in Nigeria, asking about if there was any correlation between the 3M strategy results and the incidence or prevalence of COVID-19 in Indonesia or any specific sampled locations. That's one. And then we had a question again from Haitam with the Global Wash Cluster about monitoring beyond the number of hand washing stations installed and their status or operations, which is called accountability, but a question about how the targets were set for indicators and if you had examples of where results were used to inform any actions or interventions. Mitsu and Prita?
Okay, yeah, thank you very much. So for the first questions, I think I wrote my response, but yeah, that's exactly what we are kind of trying to do to look at the correlation. But also we are aware that there are a number of confounding factors, so we may not be able to see the kind of a good correlation, but that's something we are working on. And then second point, around sorry, is this the is this the indicators or so how to inform the decisions? We were kind of producing one-pager summary to share with the local government, but also I think our effort initially was really kind of focused in Jakarta, and then we had the highest number of observations in greater Jakarta areas. Actually, the data have been used with the governor of Jakarta, and sometimes they refer to our 3M data. I'm saying that need more effort for 3M compliance and so forth. But I think still we need more kind of continued effort to kind of strengthen that feedback mechanisms, because the whole idea of this monitoring is really to support decision making at the local level. Thank you. Preeta, would you like to add? Sorry.
No, nothing much, Mitsu, thanks. Just the point that we made earlier on the need to integrate with the national monitoring system, I think is quite relevant here, because then it has a much wider reach to all the local stakeholders and decision makers at the local level in terms of really informing the programming. So I think that's something that we're planning to do next. Thank you.
Yes, I think we can definitely identify that as one of the cross-cutting recommendations. Well, thanks, Mitsu and Preeta. Let's turn next to Kenya, where we've got a question coming from Edwin in Nigeria for Dennis. Dennis, Edwin would like to know from your insights, which of the different approaches you would consider the best or the most reliable for sustaining hand washing services in public places after COVID? I'm going to also ask you to reflect upon looking forward. Do you see monitoring or interventions for hand hygiene in public spaces continuing? And then I'm going to ask you a question of my own, is that you mentioned quite powerfully that there are different types of public settings that have very different characteristics. So my question is related to Edwin's, and that's if you would recommend using different monitoring tools and programs for different settings, or if you think there's value in having them all together within one framework and data collection system. Over to you, Dennis.
Thank you. So thanks, Edwin, for the question. And just reflecting on the question around sustaining hand washing services in public spaces beyond COVID. Of course, it's a challenge because it's a new phenomenon. We are not used to washing hands while going into markets, going into supermarkets. But yes, I think it's possible, and just the same way that in the country we credit the national campaign. It was a government-led initiative that really initiated the issues around hand washing. So that is one of the initiatives that we saw quickly took root within the communities, because communities were able to quickly accept hand washing, understand the importance of hand washing, and how to go about hand washing in a proper manner. So that national government taking charge, of course, again with the partners, working through the existing structures, the management structures within these public spaces. For example, even if it's in a market, then you'd want to have the local market management structure leading that initiative. If it's a church, then you'd want the lead pastor doing that. If it's a supermarket, then the manager of that supermarket undertaking operation and maintenance. So that is something that we saw, because that ensures that there's continuous operation and maintenance of these hand washing stations. So if it's a bus station, then you have the groups that were very interested in operation and maintenance, and ensuring that there is a continuous supply of soap and water, which was very important. So that is, in a nutshell, is looking at, of course, institutional and identifying institutions that were able to continue with the operation and maintenance. So the other question is around looking at the tools. So if public hand washing stations I would classify them as having almost a similar but a few divergent issues here and there. So for example, if it's a small shop, so if it's a local shop, then you would find that these are the traffic is not as high as maybe in a supermarket or a church. If it's a church, then you'd find that the use of this hand washing station is maybe on a Saturday or on a Friday only. So they have different dynamics. So it would be important to classify some. So for example, like a marketplace, or something like a public building, or we call them bus terminal, the matatu stages, the bus terminals. So those with extremely high foot traffic, then you'd classify them under, say, that's a similar M&D framework. But then the ones that maybe like a church, issues around maybe small shop owners, maybe a street, then those would have varied dynamics. So you would want to classify them according to, say, maybe the number of people, how many times they'll be open, and what are the operation, what are the management structures and the likes. Yeah. So thank you.
All right, thanks. That makes a lot of sense to me. Okay, I think we're starting to wrap up, but I wanted to, I'll summarize a little bit of what I've heard from the case studies, but I also wanted to invite anyone else participating in the call from perhaps a different country or a different organization, if they had an experience or reflection that they wanted to share, to put something in the chat about that. And let me just say some of the things that stuck out to me, beginning with Peter's landscaping analysis, just the great variety of methods and tools that are being used. And also we see that in the 3 case studies from national efforts that were shared. And I think that's absolutely appropriate for meeting national needs. It's quite a long way away from global monitoring or producing multi-country comparisons or producing the statistic about how many people in the world wash their hands in public settings. But I also think that's okay, because the main purpose of this kind of monitoring is to improve local programming, not to produce global statistics. And we've heard some nice examples of where these data are useful and being used by local authorities. So that's great. I think for that use, there's less of a need to standardize indicators and monitoring tools, to use the same tool from one country to another. It's not so important. But there are definitely indicators and tools that work better than others. And we've heard from all of the case studies about some things that they found worked well and things that were more challenging. In Nigeria, we heard about the importance of the frequency of data collection, and especially considering market timings, whether markets are there or not on the days of data collection can have a big impact on data. From Indonesia, we had this very interesting example of crowdsourcing and using an app to collect potentially quite a lot of data, but caveating that with recognizing that gives limitations about representation and who is accessing this app and where those people are. It also implied or flagged the need for a lot of data cleaning and refresher training. And also in Kenya, we heard about different basic and secondary indicators, about the importance of identifying and understanding the sustainability measures and having them in some kind of framework. Also the importance of caretakers in the hand washing stations. I think in all of the countries, we heard examples of the challenge of how to target data collection. But again, the approaches were very different. In Nigeria, they were able to make use of listings that existed already in repositories with local governments of where the markets and the motor parks were. That's great where such lists exist. In Kenya, you flagged the idea of looking at hotspots for targeting for priority in data collection. And again, we had this crowdsourcing approach in Indonesia. This is also something that there's not one correct answer to, but any of those examples could be done well or could be done poorly. And I think one of the reasons we wanted to have this review and webinar was to share good examples so other countries in similar settings could take some inspiration and learn from what's worked well in other places. And from all of the countries, we heard about the importance of integrating with national monitoring systems and involving the National Statistics Office to make sure both that the quality of the data collected is high and that it's integrated into routine data collection. So it's more likely to be sustained, more likely to be used to inform local programming. And again, we heard examples of that happening in these case studies. So I'm inspired to hear that. The report that Peter worked on is available online. It's on our website. You've seen the link to it. If it would be useful, we would be keen to update that review in the future, especially as more tools and especially as more data become available. It might be that we would find more data or more areas for convergence in one particular setting, in the way that we already focus on households and schools and healthcare facilities as specific settings. Maybe one of these settings where monitoring is happening will emerge as something that could eventually be monitored at the global level. But for now, I think the focus is really on strengthening national monitoring systems and taking the good examples we've seen, adding others, and just sharing those with others. So with that, I don't see that anyone's added to the chat to share a reflection. So I'm going to pass the microphone over to Ann Thomas with UNICEF and the headquarters program division to say some final words. Over to you, Ann.
Thanks, Rick, and thanks to the entire team at the JMP and to the 3 countries that presented today. I think the presentations were very inspiring and useful in starting our collective thinking around how we strengthen monitoring and evaluation for hand washing in public places. Just a couple of points to share from the work at UNICEF and sort of reflecting on also the trends that we're seeing as part of Hand Hygiene for All. One is, this past couple of years have shown us an incredible amount of attention on hand hygiene and really the emergence of hand hygiene as a legitimate public policy issue. We're seeing countries that have included hand hygiene in their frontline strategies for COVID. We're beyond the usual rhetoric of hand washing during the pandemic and then a drop in practice. We're seeing countries that are really trying to embed hand washing as part of ongoing programs, looking at how national policies can translate into accountability frameworks. And I think the monitoring systems are really a strong organic part of that policy piece. Getting good data on the ground can inform stronger policies and also point the way for how we make hand washing a more ubiquitous practice across society. And I think generally we all know there are many pieces to this puzzle. From the behavior change, which we've worked on for many decades now. How do we most effectively sustain behavior change? To the facilities themselves, how do we sustain practice? What are the nudge pieces that we can innovate for to ensure that hand washing is sustained beyond the sort of emergency response phases in multiple settings? And then, of course, the public policy piece, which is such an important piece that we're seeing now. How do we sustain the leadership on hand washing? And again, I think data is sort of a cross-cutting piece of this puzzle, informing better policies and better practice. So how do we use this data not only just for the M&E purposes and getting it right, but also for advocacy and action at country level? I think finally, this issue of transitioning from response to long-term sustainability is really the heart of the matter now. How do we continue to sustain the attention that we've had on hand washing? How do we've seen that in many instances, having caretakers or monitors at public places is really truly an effective way of increasing practice. But how do we sustain this going forward? These are some of the questions we have. Some of the priorities that we have globally at the moment are around looking at the innovations needed for public places in terms of the actual facilities themselves. We're also seeing, looking at leadership and capacity building as another piece of this, and how we sustain hand washing behaviors going forward. I think just on a final note, just the fact that we're having these conversations about strengthening our monitoring approaches in public places is a great sign that we are really transitioning towards mainstreaming hand washing in public places. And we really encourage you to look at these efforts to strengthen the M&E approaches and data collection as also an entryway for strengthening public policy and leadership in your respective countries. So I think on that note, thanks very much for joining, and great work in the countries, fantastic presentations, and we look forward to hearing more and supporting these initiatives as you go forward. Over.